Welcome to the GIN Masterclass on Heat Action Plans. We're delighted you could join us. We look forward to your questions and experiences later. My task is to give a broad overview about heat action plans. Then you'll hear from Peter and Abhiyant with more details about experiences in Canada and in India. Throughout the masterclass, you've heard quite a bit about heat wave early warning systems. And I want to put heat wave early warning systems into the larger context of a heat action plan. These are the cover of 2 action plans. I'll talk about elements of these briefly. You'll hear about similar elements in a lot more detail in the other presentations. This is the heat wave plan for England. And there's a couple of important points here about heat action plans. The first is these plans are long-term. An important element of a heat action plan is to have a heat wave early warning system, but that's only one component. There needs to be longer-term planning, thinking about what the future might bring, longer, more intense heat waves. What does that mean in terms not just of protecting vulnerable individuals, but what does it mean in terms of protecting our healthcare facilities, thinking about installation of green roofs, and other activities to make a city much more resilient to a warmer future. The other key point here on the right side is you can see the broad range of stakeholders that are engaged in this heat wave plan for England, that this plan has built up over many years and has really made an effort to reach across civil society, various levels of government, and various agencies and organizations across the UK to make sure that people who have a stake in these plans, including people who are most vulnerable, have a way to interact to ensure that the plan is as effective as possible. These plans can save lives. These are some statistics from the Ahmedabad Heat Action Plan. You'll hear a lot more about this from Abhiyant. This plan is so effective that just a few weeks ago, it won the Ashton Award for Sustainable Solutions. So congratulations to Abhiyant and all the others who worked on this heat action plan. And you can see saving lives, installing cool roofs, and really improving the lives of millions of people. These are some of the general principles of heat action plans. I've noted that many of these statements come from a document from the European Regional Office of WHO, and we'll make sure that we make that available so that you can read it in more detail. Experience with these plans indicate that they are most effective when they build on existing systems and link to general emergency response. It's important to take a multi-agency and intersectoral approach. So as you saw for the UK, you ensure that everyone is at the table who can help make sure that these plans are effective as possible. Taking a longer-term approach, thinking not just about this summer, but the summers to come, and including what you need to do before next summer. And what do you need to do in the longer term to ensure that the city becomes more resilient as the climate continues to change. As we've seen dramatically in many countries, communication is critically important around issues. In case of the countries right now, it's COVID-19. We're also seeing many parts of the world suffering heat waves right now. So making sure that you've got a risk communication plan, that you understand public perceptions and public beliefs, and there's an effort to build trust through the plan so that as you go forward, people do pay attention to the warnings and do take appropriate action to reduce not only their vulnerability, but the vulnerability of their family and friends. There often will be a need to build capacity around these systems. There is a challenge in many countries that many people do not understand that heat is a health risk. Heat is a number one killer, weather-related killer, in many high-income countries. We don't have very good data for low and middle-income countries, but it is a major killer, and people don't understand that. So capacity and awareness have to be built, and there has to be efforts in understanding what are the most effective behavioral changes to ensure that people are protected when the temperatures go up. As always, it's important to be transparent, and the systems need to be constructed so that there's monitoring, evaluation, and learning. That as the system goes, you continue to revise it. In the UK and in other places, there are annual efforts to update the plan, to look at what happened the summer before, see what was learned, see where the gaps are, and make sure that there's continual improvement. These are the core elements of a heat action plan. This is similar to what you saw for the slide from the UK, where there is a lead agency that's going to take primary responsibility, working with a broad range of stakeholders. For the heat action plan itself, not the overall heat action plan, but the heat wave early warning system, ensuring there's accurate and timely alert systems, making sure that there are communication plans, and thinking about issues such as reducing indoor heat exposure, focusing on vulnerable population groups, looking at the preparedness of the health and social care system, which includes looking at the facilities themselves. There are places where the temperatures are so high that the healthcare facilities are having challenges, either because the temperatures are too high to run the equipment for cooling, or because they're overrun with people coming in with heat stress, or both. And so thinking about the perspective of the health and social care systems, making sure that the plan has a way to reach out to particularly vulnerable groups. There is quite a large program in Phoenix, Arizona, in terms of its heat wave early warning system. And one thing they've discovered is that many of their deaths are in the homeless. And so part of their plan is through the social care system, how to reach out to the homeless to make sure that they are protected when there's a heat wave. I mentioned long-term urban planning before. It's critically important to think about how our communities can be survivable with much higher temperatures. And there should be surveillance, real-time, to the extent you can get real-time surveillance, and that continual evaluation so that you look at all of the opportunities for improvement. And that learning can come not only from what was experienced within this community, but through the GIN network of learning what was effective in other communities and finding out what their lessons learned. So the GIN network gives you a real opportunity to take a look at what others have done to test them in your community and see what is effective. This shows you the possible flow of information between a lead agency and other actors in heat health action plans. It makes the same point, but sometimes it's helpful to see this as a flow chart of how the different actors can come together and how that flow of information can go to make sure that in the end you do have an effective and efficient system. It's often useful when you have a heat action plan to develop checklists. This is a list of some of the possible groups where you might want to have a checklist. I've mentioned vulnerable groups, public communication, health services, indoor cooling and cooling centers, of thinking of what needs to be done in case, for example, there's a power outage, and how to make sure that cooling can be maintained, and what are the safe ways to do so. In some parts of the world, it's important to take a look at the combination of temperature and humidity to see whether fans could be effective or not. In some circumstances, fans are not effective, and should not be recommended. So knowing in advance what needs to be done means that when that situation arises, people will be prepared to take action. Collaboration with electric utilities to understand what kinds of decisions they may have to make under an extended heat wave, a particularly hot heat wave, to make sure that their equipment runs effectively, and whether they may need to somewhat limit access to electricity. I mentioned healthcare facilities. Also think about outdoor public spaces and what can be done in those public spaces. This is critically important with COVID. There's quite a lot of information about this on the GIN website about thinking about how to be protective so people are not experiencing heat strain when there's very high temperatures, but also protected from COVID. And also thinking about the workforce, what needs to be done to protect outdoor workers, for example, when the temperatures get higher. These are some of the timing elements of a heat action plan. There's a longer-term development and planning component. I've mentioned that several times. Preparation for the summer, prevention during the summer, specific responses to heat waves, and then, of course, monitoring and evaluation. As you establish a heat action plan, it's often very helpful to think about these different temporal scales and who will take responsibility for these different scales. The longer-term development and planning may fall with an urban planning department, for example. Preparation for the summer may be the responsibility of the health system. And so making sure that the roles and responsibilities are well established, people know who will take responsibility for what, and how those handshakes work will ensure a more effective system. These are some example recommendations for urban planning and housing. Short-term, medium-term, and long-term. I've mentioned many of these. And so, again, the temporal scale is really quite important, and making sure that that is addressed within your heat action plan. And when you think about the plan, it's really important to make sure that the plan is adaptive to climate change. Many of the early plans, when they were set up, didn't take climate change explicitly into account. But climate change is bringing longer, stronger, more frequent heat waves. And so thinking about questions like, when should the time period covered by a heat wave early warning system be changed? Many systems in the Northern Hemisphere run from sometime in mid-May, sometime in mid-September. But we're seeing heat waves earlier in May. We're seeing heat waves later in September. There's operating costs for these systems, and so there are trade-offs, and they need to be made explicitly between when you turn the system on and when you turn it off, and how you think about shifting those time periods as temperatures continue to go up. The duration and return period of heat waves, we're seeing more compound heat waves, where there are several days of very high temperatures, maybe a cooler day or two, and then the temperatures go back up again. And how are those going to be handled within the heat action plan to ensure that people are protected as they experience waves of high temperatures? The geographic extent of heat waves seem to be getting much larger. Some of the early heat waves that really caught the attention of public health were on the city scale size, and now they're much larger. And that does mean that you need to think about how to collaborate and coordinate with neighboring cities so that conflicting information isn't being provided. Heat wave duration, heat waves are getting longer, and that's got implications for communication plans. How do you keep communicating that heat is a risk when this goes on day after day, maybe for 2 weeks? We're seeing unprecedented intensity. And there's other issues as well. There's some research suggesting that when winter mortality is lower, so when the particularly susceptible groups don't die during the winter season, they may be at higher risk for heat waves the following summer. It's a call for research to operations to follow what's going on in the research so that when discoveries are made that are important, that need to be taken into account in your heat action plan, that it's done so in a timely manner. You may need to prioritize health outcomes. As temperatures shift, you may find that the particularly vulnerable groups also could shift over time. And then finally, we don't know what's going to happen with exposure-response relationships. People acclimatize, cities adapt, individuals buy some kind of cooling mechanism. There's lots of changes going on in our development pathways, which mean that the risks will shift over time. And we need to think about how those risks could take place and have an action plan that is agile and able to deal with those. One particular tool is possible to use is stress testing. And this is to work with the actors, the stakeholders involved in your heat action plan, and to have desk-based exercises where you work through what you would do if there was a particularly intense heat wave, so that everyone has practice and is better prepared when such heat waves happen. Example is last year and the year before, there was very intense heat waves in parts of Northern Europe and parts of Asia. In Japan, there was temperatures that were outside the range of what had been experienced before, and making sure that our heat action plans can really protect people when we're surprised by these very strong events. With that, I'd like to thank you very much for listening, and I look forward to your experiences and your questions later. Thank you.